New hospitalization numbers show an alarming jump in the number of children affected by COVID-19. A study in the journal JAMA Pediatrics finds more than 5,300 children and teenagers in 22 states were hospitalized with the disease between May and November. Denise Valdez joining us now with more in today's Health Watch.
Well, Christian, we are talking about multi-system inflammatory syndrome, and we have had a handful of cases here in Nevada and Clark County. The symptoms can present really just like any other virus, but it can lead to some serious complications, which in that case is going to be that inflammation we've been talking about. Now, you would never guess that 8-year-old Van Fuqua is bouncing back from a disease that left him struggling in a hospital bed. Now, his mother, Kate, got the virus in November, so the entire family quarantined as a precaution. A month later, Van was hit with fatigue first, then a fever of 104 degrees, a rash on his body, he had a strawberry tongue, and trouble walking. Now, this is interesting. He tested negative for strep, the flu, and 2 COVID tests came back negative, leaving doctors just scrambling to figure out what was wrong.
He had some really scary numbers on his labs, like his heart was in heart failure, his kidneys looked bad, his liver looked bad. So they were really scrambling, trying to figure out, which one of these systems is the culprit, and none of them were. It was all an inflammation reaction to the virus.
So the culprit was the COVID-19 virus, and the diagnosis was MIS-C, short for multi-system inflammatory syndrome. Now, it is relatively rare, but the complication often presents itself in children. More states across the country are now reporting increases in pediatric COVID hospitalizations. Take a look at the map. In Utah, a 5,000% increase. Arizona, 4,000. Wisconsin, South Dakota, Ohio, and Minnesota are all reporting a more than 1,000% increase in these cases in kids. Now, since May, there have been around 1,700 cases of multi-system inflammatory syndrome and 26 deaths. And remember, it can pop up long after COVID is gone. Children with MIS-C may have fever, various symptoms, things including like abdominal pain, vomiting, diarrhea, neck pain, rash, and bloodshot eyes, or they're just feeling really extra tired. So something to be aware of as we start to slowly now phase out from COVID-19. Back to you guys.